Good afternoon, and I'd like to start with a warm welcome to this new building, and a big thank you to you for being with us, to the speakers that have accepted to join this stakeholders forum, and in particular to colleagues involved in the organization. And I'd like to thank Valerie Muldoon for her work in terms of coordination and making sure that this meeting is actually happening. My presentation is a sort of three-dimensional bridge between session one, this current session, and the following sessions, between what has been achieved in terms of implementation of pharmacovigilance versus what is operating. And the third dimension is probably to sort of link the legislation with the other important aspects that are there to promote and protect public health. So it's, in a sense, one way to zoom out or to map out what's going on and how we promote and protect public health. I thought I would start this presentation with this sort of hourglass concept, where at the top of this hourglass, we've got, well, we had back in 2010, the legislation to be implemented. The journey actually started in 2009, where we put in place at the agency and with the member states, very complex, what they labeled complex, governance structure to make sure that we could implement everything in a very efficient and effective manner. So the journey started in 2009, and basically, where we are in 2014 is something at the top still to be implemented, but quite a lot, which is actually in operation. 80% is actually in operation. We still have, and don't get me wrong, some key outstanding deliverables to be delivered. In particular, and Peter Arlett mentioned them earlier, good vigilance practices, guidance, and IT systems. So the beauty with PowerPoint actually is that you can fit in one box GVP, guidance, IT systems, and it looks like it's going to be done this way. This little box represents quite a lot of work to be achieved in terms of people, process, and system. And also, it requires lots of collaboration, cooperation between us, between every stakeholders in this, involved in this activity. But what we shouldn't forget is that ultimately, we want to set up a sustainable, more digital, efficient, integrated, and collaborative EU pharmacovigilance system. That's the target. But the system is there only to support the promotion and protection of public health. In itself, the establishment of an EU pharmacovigilance system is not a goal, it's a mean to a goal. I thought I would also remember ourselves that the promotion and protection of public health relies on three important pillars. The first one, which I have already mentioned, which is the legislation. The second one is the EU system. I've also mentioned that. And it's about, as I said, people, processes, and systems. People for capacity, recruitment, training. In terms of processes, it's about making sure that the system operates in a very efficient, well, effective and efficient manner. And one example is the SCOPE project here to support that. In terms of systems, the IT systems and databases, which obviously rely on good data. Another very important pillar, and this has been mentioned previously by Peter Arlett as well, and June Rain, science. How do we ensure that we have a rational decision-making? That we make decisions that are proportionate, that can be evidence-based, that we can rely on something. And in this respect, there are lots of initiatives to make sure that the science support the promotion and protection of public health. And I've got a couple of examples here that will be further developed by the following speakers. But Protect Advanced, which has been mentioned by Peter Arlett, Web Radar, and SEP, which is also about capacity and training. And this wouldn't be possible, obviously, without auditing and measuring the system that you use to do this. So process improvement and efficiency, which is very much linked to outputs of the system, it's very important. But also on the left corner, the impact measurements, which is about outcomes and about understanding that what we do actually has a daily life effect. The fact that behavior, the fact that conception of people will change in their daily life, the way they will take the medicines, the way they will not take their medicines, the way they will interact with their healthcare professionals, and so on. This is part of the impact assessment. But to assess, you need to measure. You need to find right ways to measure. And this is where collaboration comes in, because there are many ways to see the world, many ways to cut the cake, but that's why we bring together stakeholders to discuss and to agree on ways to see the world, common ways to see the world, and to understand the way to measure things. So that was a very short presentation from my side. As I said, it's a link to the rest. I thought that I would conclude by sharing something more personal. So on the left side, it's an old atlas touch. I have a sort of passion for maps and old maps. And this reminds me of the pioneers that took their ships centuries ago. They were the first one. They were sailing, navigating, sometimes without knowing where they were going. And they came back mapping the world. And in doing so, they made the others, they made the journeys of the others safer. I think that's what we are sort of doing. The second picture, the one on the right, it's the Canal du Midi, which you may know, which in itself is a fantastic vision. It was built in the 17th century in France. And the idea was to join up the Atlantic Ocean and the Mediterranean, because France was at war with Spain. So it was one way to sort of shortcut the trip. And the beauty of it is that, well, there was a vision. It has been a tremendous effort to achieve the Canal du Midi. But when you navigate on the Canal du Midi, and I hope you will do it one day, the thing is, you enjoy the destination. You know exactly that you start from point A and you will reach point B in 7 days, in 10 days, whatever. But the importance is also to enjoy the journey. So what we are doing now, what we are building together, I hope we will enjoy the journey. Thank you very much.